What is sleep apnea? Sleep apnea is a sleep disorder characterized by repeated interruptions in breathing during sleep. These interruptions, called apneas, can last from a few seconds to minutes and may occur multiple times per hour. Sleep apnea reduces oxygen levels in the body, leading to poor sleep quality and potential long-term health complications. How sleep apnea works? Breathing stops. The pause in breathing can cause a drop in oxygen levels, leading to stress on the body. Brain signals the body to wake up. The brain senses the lack of oxygen and briefly wakes the person up to resume breathing. This awakening is often so brief that the person may not remember it. Cycle repeats. Throughout the night, the person may experience dozens or even hundreds of these episodes each night, leading to fragmented sleep and health issues. What are the types of sleep apnea? Obstructive sleep apnea, OSA, most common type, occurs when the muscles in the throat relax excessively. Risk factors: obesity, enlarged tonsils, a small airway, smoking. Central sleep apnea, CSA, occurs when the brain fails to send proper signals to the muscles that control breathing, often linked to neurological conditions, heart failure, or stroke. What are the effects on the body? Interrupted sleep, oxygen deprivation, hormonal changes, increased blood pressure, inflammation. What are the symptoms of sleep apnea? Loud snoring, gasping or choking during sleep, difficulty concentrating, morning headaches, irritability or mood swings, insomnia, dry mouth or sore throat. What are the complications of sleep apnea? Cardiovascular issues, high blood pressure, heart disease, stroke, and arrhythmias. Metabolic disorders, increased risk of type 2 diabetes. Mental health problems, anxiety, depression, and mood swings. Accidents and injuries, higher likelihood of drowsy driving and workplace accidents. Decreased life expectancy due to long-term health complications. How do you diagnose sleep apnea? A doctor may perform a physical exam and assess medical history to check for risk factors. Polysomnography, an overnight sleep study conducted in a lab, monitoring brain activity, breathing patterns, and oxygen levels. Home sleep apnea test, a portable test that monitors breathing and oxygen levels at home. What are the treatment options of sleep apnea? Lifestyle modifications, weight loss, sleeping on one side, quitting smoking, regular exercise. Medical treatments: continuous positive airway pressure, CPAP machine, delivers pressurized air to keep the airway open during sleep. Bilevel positive airway pressure, BiPAP machine, similar to CPAP but provides different pressure levels for inhalation and exhalation. Surgical procedures: uvulopalatalpharyngoplasty, UPPP, removal of excess throat tissue. Tonsillectomy or adenoidectomy, often done in children to remove enlarged tonsils. Inspire therapy, a surgically implanted device that stimulates airway muscles. Conclusions. Sleep apnea is a serious but manageable condition that requires early diagnosis and treatment to improve quality of life and prevent complications. If you're curious or experiencing symptoms of sleep apnea, don't ignore the signs. Consult an ENT or head and neck surgeon today for expert evaluation and care.